Am I a good candidate for rhinoplasty? This is a common question that I come across. Suitability for rhinoplasty depends on whether you're looking for an aesthetic rhinoplasty, whether it is mainly breathing problems, or if you're looking for a combination of solving and resolving your aesthetic as well as your functional breathing concerns. I see patients that have both issues from an aesthetic point of view as well as from a breathing point of view. In terms of aesthetics, you may be a candidate for rhinoplasty if you have a large dorsal hump and you want to look better in your profile view, if you have a very bulbous tip, if you have a droopy tip. All of these reasons make you a possible candidate for rhinoplasty. In terms of breathing, if you have a septal deviation, this is also another factor that may make you a candidate for a septoplasty and hence a rhinoplasty. What is ultrasonic rhinoplasty? Ultrasonic rhinoplasty refers to the use of a specialist piece of kit known as a piezoelectric saw, which is based on the piezoelectric principle. The saw uses ultrasound to make cuts to the bone and in this way limit the damage to the surrounding soft tissue structures. In this way, this translates into less bruising, swelling and a faster recovery. In short, this is an advanced technology that has been introduced into the field of rhinoplasty a few years ago and has made quite drastic differences in terms of recovery and bruising and swelling to patients who do choose to have this option. What is the difference between open and closed rhinoplasty? Essentially, the term open and closed refers to two different approaches to performing a rhinoplasty. The open approach refers to the skin over the nose is lifted up and all the adjustments made under vision so that we can see exactly what we are doing to the cartilaginous framework of the nose. On the other hand, in a closed approach, the incisions for access into the nose is made within the skin of the nose on the inside, the layer referred to as the mucosa, and all changes done without lifting the top layer of skin overlying the cartilages of the nose. There are advantages and disadvantages to each approach. The open approach, the main advantage being that it is great to visualize all the changes that we need to make on the nose. However, because of the extensive dissection, it is possible to get a lot more bruising and swelling as a result of this approach to surgery. The closed approach, on the other hand, while minimizing trauma to the tissues and reducing bruising and swelling, it does mean that it's quite difficult to see what we are doing and so is much more challenging in terms of the approach itself and making the changes that we need. So that's essentially the difference between open and closed rhinoplasty. How long do the results following a rhinoplasty last? This is, in short, a difficult question to answer, but a rhinoplasty in general is for life. It is possible, however, that your rhinoplasty may evolve as the years progress. In general, following rhinoplasty, it takes around 12 to 18 months for you to appreciate the final result. That said though, it is always possible that as time goes by, there may be some evolution of the rhinoplasty that you had. It is extremely important that the cartilaginous foundation of the nose is stable and well formed and built strong as best as it possibly can during your rhinoplasty. This will ensure that your result lasts as long as it possibly can. Despite this, however, and despite our best efforts, it is always possible that you may need some minor tweaks as well as some maintenance treatments such as fillers in case your rhinoplasty result does start to alter. In short, rhinoplasty, a result is for life, but it is possible that it could evolve with time, although in general, the vast majority of patients are happy following rhinoplasty and rarely need further surgery later down the line. How long does it take to recover from rhinoplasty? A rhinoplasty usually results in bruising and swelling, 50 to 60% of which usually settles down at around 2 weeks' time. It is difficult to give exact time frames, however, most patients fit this time frame. It is still possible that you may continue to have bruising and swelling that is significant beyond this period of 2 weeks. In fact, most of the time, it takes at least 12 to 18 months for all of the swelling and the bruising to settle down. However, in the vast majority of cases, 50 to 60% of the bruising and swelling does settle down within the first 2 weeks. Of course, this is individualized to each patient, and each patient is different, so you may have more bruising and swelling that lasts longer than somebody else, and this is nothing to be concerned about. How much does rhinoplasty cost? The cost of a rhinoplasty is dependent on a number of factors. These include the length of time that your rhinoplasty will take, the number of complex maneuvers required to achieve your goals, and the need for specialist equipment. Our team at CFS is able to provide you with finance options, and the best way to discuss this would be with one of our patient coordinators who will be able to help you in this regard.